Okay, so I just want to first say hello, everybody. Welcome and thank you for joining us today for this informational how-to webinar on the Jeffries Insights program in the Latin American region. So we wanted to provide this webinar to hopefully answer any questions that you might have and provide helpful information to you to make the process easier if you're having any challenges or if you're just starting out and you need more information on the process and the logistics of the program. So that's what we're going to focus on today. So let me see. Okay, so just a brief overview of the agenda for today. I'm just going to quickly go over a brief introduction of the Jeffrey Modell Foundation and primary immunodeficiency, and then a very brief overview of the Jeffries Insights program. And then from there, the Veritas team is going to take over, give you a little background on the company, Veritas, the company, and then dive deep into the logistics and operations information that I think will be probably the most helpful portion of this webinar. And then we will have time for questions if anybody has any questions or comments or needs any assistance. So I will get right to it. So just a brief background on the Jeffrey Modell Foundation. JMF is a global nonprofit organization dedicated to early diagnosis, meaningful treatments, and ultimately cures for primary immunodeficiency. Through awareness, advocacy, and research. Vicki and Fred Modell established the Jeffrey Modell Foundation in 1987 in memory of their son, Jeffrey, who unfortunately passed away at the age of 15 from complications of PI. And along that journey, he asked his parents to do something. And they did, and they have, and they continue to do so along with the JMF team. And we continue to carry that legacy forward for the global PI community. So just a very brief background on primary immunodeficiency. It is a group of over 485 genetic disorders of the immune system that are chronic, serious, and sometimes life-threatening. And it affects 10 million people worldwide. And these patients often undergo what is referred to as a diagnostic odyssey, which is the long, winding journey they take to receive a definitive diagnosis. And this underdiagnosis leads to poor disease management, lack of treatment, serious recurrent infections, permanent organ and tissue damage, and sometimes death. And important to note that diagnosing a single patient with PI can save our healthcare system almost $100,000 a year here in the United States. So we have the Jeffrey Modell Centers Network. It was established decades ago, and it consists of 930 physicians at 415 institutions, 325 cities, and 89 countries, and encompasses over 260,000 patients at this point, and it's constantly growing. And the Jeffries Insights genetic sequencing program, which is what we're here to talk about today, is offered to that entire network of physicians globally at no cost. The program to date has sequenced over 4,000 patients and identified over 25,000 variants. And we have found that results of genetic sequencing have altered clinical diagnosis in 39% of patients, disease management in 38% of patients, treatment in 35% of patients, and genetic counseling in 53% of patients. So it has had a tremendous impact on patient disease management, treatment, and outcomes. And we have found that even in patients that don't receive a definitive genetic diagnosis that receive, variants of uncertain significance, it still can affect their treatment, their disease management, and improve the outcomes. And so you can see here the latest publishing of the results of this program was in 2022 in Frontiers in Immunology, and you can see the citation here. And we are working on an updated publishing of the program. So that will be out early next year, hopefully. So keep an eye out for that. So that's just a brief introduction. So now I will hand it over to the Veritas team to keep it going. Thank you.
All right, thank you, Jessica. My name is Matthew Dixon, and I'm the Chief Business Officer of Veritas Genetics. And here I'm here to give you a little bit of background about our company, who we are, and as Jessica said, we're here supporting the foundation, and so I want to give you a little bit of overview about our company and let you know who you're working with. So as far as Veritas, we were started as the genome company. So we're founded, one of our founders is Dr. George Church, and he led the whole genome project. And as part of that, it was in 2004 when they first read the complete whole genome. But based on that, the idea was to bring whole genome sequencing and in general genetics to the world and to the masses. As part of that, though, we do several different services. But as you can see, that we've been recognized by some very important institutions, and been very as developed as I think we were founded in 2014, and have been growing ever since. We have laboratories that are based on whole genome sequencing, whole exome sequencing, and we do non-invasive perinatal testing. We have laboratories in Monrovia, California, and our European laboratory where the Jeffrey Model samples are processed is in Barcelona, Spain. So ISO certified, fully functional, next generation sequencing laboratory. As far as our company, our pillars are, we want to improve healthcare through genetics. And if you see the three pillars we focus on, we want to be clinically relevant information. So we're not focused in the types of genetics for fun. We're more genetics for life, how we can effectively improve healthcare. And that's through clinically relevant information. The second one there is physician assisted. So we prescribe our tests through physicians, and it's managed by physicians. It's managed by genetic counseling, because we want this information to be provided to the patient and explained correctly and understood. And that's one of the foundations of our company. And then a resource for life. We focus what we do on whole exome sequencing and whole genome sequencing. With that data that you sequence or you're given through that process, it can be reanalyzed. As science evolves, we can further expand what we've learned, and that's why we focused on resource for life, and it's one of our three key elements of what we do. So you can see we have key partnerships throughout the world. Some of these are the Institute of Cancer Research in the United Kingdom, Mayo Clinic in the United States. There is Clínica Navarra, which is a private hospital hospital chain in Spain. The Royal Marsden, so well recognized institutions. I'm going to let this person into I see that I have a bunch of people waiting in the waiting room. Next, you can see we're Veritas, a Let's Get Checked company. 2 years ago, we merged with Let's Get Checked, and now we're a part of this company, which is Let's Get Checked is a digital healthcare company, more focused in the United States, but you'll see that logo and it just gives us breadth and more infrastructure. But we are the genetics part of their overall business. And then just wanted to explain why you would see that as part of our Let's Get Checked company. And you can see some of the scope of how large the business is. See some of the partners that in the US, we really focus on these 4 categories: health plans, employers, public sector, platform as a service, and that reinforces where we can and how we can distribute our services around the world. As you can see, we have a very robust portfolio of genetic services, and we break it down into these areas where you'll see preventative medicine, diagnostic genetics, and prenatal medicine. Specifically, what we do with Jeffrey Model is the diagnostic genetics, and we have a customized panel that's focused on immune deficiency, as Jessica mentioned, and as you all know, I'm sure. And then just to give you a little bit more background on why we're thought of as the genome company, because one of our champion products is that we do whole genome sequencing, full interpretation analysis, and these are some of the elements that are part of that analysis. So really very comprehensive, and it really does positively affect the proactive healthcare of our patients. And just to give you some idea of who we are, myself, I've already introduced myself. I am responsible for the overall project from the Veritas side. Sofia Quintana, which will be presenting after me. She's the operations manager and helps with logistics, operations, and all aspects of that of the program. Fabricio Favara is also heading the operations logistics part. And Marta Piero is program communication, so marketing communication director here at Veritas, but she does a lot of the emails, not a lot of the emails, the website, the way we try and communicate to you about how it is best to both enlist in our program, order test, all that's managed by her team. So these are not me necessarily, but these are three people are very critical in allowing you to understand how to order test and qualify for that. And you'll also see in a minute another person that's located in Colombia that is our lead in operations, sales operations, Isabel Arana. She's also presenting in this at the end of this presentation. And now I will leave it to Sophia and let her tell you a little more about how to enlist in the program and then order test.
Thanks, Matt. Bien, pese a que el programa es todo en inglés, vamos a hacer esta parte en español para que sea más comprensible para todos ustedes. Sin embargo, no se preocupen porque al final de la sesión dejaremos un espacio para que puedan hacer preguntas en caso de que no haya quedado algo claro. Pues bien, en esta parte vamos a ir repasando el paso a paso de este proceso que hemos diseñado para que ustedes puedan registrarse en el programa, puedan enviarnos sus muestras a nuestro laboratorio y puedan recibir el resultado de sus muestras. Entonces, el proceso diseñado es muy simple, consta de 3 pasos. En un primer paso tenemos el registro del microsite. Recibirán por parte de la Fundación Jeffrey Model un link donde simplemente tendrán que registrarse y allí nos podrán proporcionar sus datos, personales en cuanto a la dirección para que les enviemos los kits de extracción si los necesitan y nos puedan proporcionar sus detalles de contacto para recibir las credenciales a nuestra plataforma. El segundo paso hablaremos del registro de muestras para que puedan enviarnos las muestras a nuestro laboratorio. Es un proceso muy simple de envío. Ustedes recibirán las muestras, harán la recolección de la muestra y la podrán enviar a nuestro laboratorio siguiendo unas instrucciones muy sencillas y de esta manera les podremos proporcionar el resultado a través de la plataforma que ya habrán visto previamente. Pues bien, empezamos con el primer paso. Como les he mencionado, recibirán un link por parte de la Fundación Jeffrey Model. Simplemente podrán hacer el login con sus datos y allí acceder al microsite. Una vez se hayan introducido en el microsite, verán que hay 2 pasos muy sencillos. El primer paso es la información personal, donde se les pide un nombre de contacto con un email y finalmente una dirección. A esa dirección les pedimos que sean lo más detallados posibles, ya que es a donde les enviaremos los kits de extracción en caso de que así lo requieran. Entonces, una vez finalizado este paso, pasaríamos al segundo paso, donde se les da la opción de pedir test de extracción si así lo precisan. Ofrecemos la opción de hacerlo a través de test de sangre o test de saliva. En caso de que ustedes ya tengan kits de sangre o de saliva, que les ponemos también en este mismo step los detalles de los kits compatibles con nuestros robots, podrían simplemente seleccionar la opción de I have my own test y simplemente nos pondríamos en contacto con ustedes para enviarles las instrucciones y los datos para que nos envíen de vuelta sus muestras. Esto lo veremos en un momento más adelante. Una vez ya hemos finalizado el registro en la plataforma, nuestro departamento logístico les enviará los kits que hayan solicitado, en caso de que lo hayan hecho, y recibirán los kits solicitados con todas las instrucciones que precisen. En este caso, encontrarán unas instrucciones de toma de muestra, donde se les detalla cómo realizar la muestra. Verán que todas las muestras, todos los kits vienen incluidos con unos sample IDs, que son unos códigos de barras, para poder identificar tanto el tubo como el peticionario de muestra y un tubo o kit de extracción. Entonces, en las instrucciones se detalla bien cómo pueden realizar la extracción. En caso de que tengan cualquier duda, también les aparece un email donde pueden contactarnos y nuestro equipo se pondrá en contacto con vosotros, con ustedes para ayudarles. Y a continuación también encontrarán en la caja las instrucciones de envío de muestra, donde les aparece detallado cómo enviar las muestras a nuestro laboratorio. Entonces, en estas mismas instrucciones de toma de muestra también verán un código QR donde al escanearlo pueden acceder a un vídeo que ahora veremos, donde se detalla cómo registrar su order en nuestra plataforma. Al registrarse en el microsite también se están registrando en nuestra plataforma, entonces recibirán un email automático al email que hayan registrado con unas credenciales de acceso a nuestra plataforma. Entonces, al hacer login en nuestra plataforma, es una plataforma que ahora veremos, es muy intuitiva y simplemente es necesario registrar la información clínica de su paciente y la información personal, que es exactamente los mismos datos que verán en el peticionario que les viene junto con el kit. Entonces, ahora vamos a ver el vídeo que podrán también ver en el microsite y en el código QR de las instrucciones, donde se explica al detalle cómo pueden registrar sus orders en nuestra plataforma.
Dear partner, welcome to Veritas Intercontinental. You have just started your first onboarding session where we will explain you how to register an order in the Veritas Customer Management Portal. You should have received an email from Veritas Intercontinental with your access credentials. To log in, it is as simple as clicking into the link and placing your username and password. Once you are logged in, click into Register a new test and select the test you want to order. As you click on it, you will immediately see that the requested files are the same as the ones of the requisition form. Please transfer all the patient and clinical information into the required files. Consider that the sample ID corresponds to the barcode label pasted into the tube of the sample. Then, add the ordering physician information. In case the physician has already been registered for a previous test, all the data of the section will appear automatically when introducing the first name. We kindly ask you to be as much accurate as possible when filling out the clinical information section and the clinical indicators. Finally, fill in the informed consent and submit the form. When submitted, you will be able to check if all information is correct and then sign the document. The signature process can be done in two different ways. The first one is uploading the scanned requisition form, fulfill and sign manually, whereas the second way is signing the document digitally. Either if you choose the first or the second way, the requisition form must be signed by both patient and physician. Now your order has been submitted. Thank you very much for watching this onboarding session.
Bien, pues como han podido ver en este vídeo, el portal resulta bastante intuitivo, es decir, simplemente tienen que darle a Register an Order y introducir todos los datos del peticionario en el sistema. Entonces, la parte que sí que es muy importante tener en cuenta es que
Welcome to Veritas Intercontinental.
Disculpen. Perfecto. Entonces, la parte que sí que es muy importante es tener en cuenta que cuando nos pide de subir manualmente el documento, es importante que sea el documento entero. Verán que hay una parte que es el peticionario, donde aparece la información clínica y la prescripción médica del doctor, y por otra parte el consentimiento informado. Entonces, si desean realizar el upload del documento, es muy importante que sea entero de ambas partes. De lo contrario, si deciden hacer el registro totalmente digital, como han visto en el vídeo, pueden simplemente acceder al link de la firma y firmar ambas casillas, una del paciente y la otra del prescriptor, es decir, del doctor. Pero siempre es muy importante que todos los peticionarios vayan firmados por ambas partes, por doctor y por paciente. Entonces, voy a dar paso a mi compañera Isabel para que les explique toda la parte logística. Como hemos dicho en la caja que recibirán con los kits de extracción, ya verán unas instrucciones de envío donde se detalla todo, pero aún así vamos a revisarlo en esta sesión para que quede todo bien claro.
Bueno, muy buenos días a todos. Como le estaba mencionando Sofía, sí, una vez ustedes reciben los kits para la recolección de las muestras, también se les van a enviar sobres para el retorno de las mismas, los documentos AW, que son las guías de envío de nuevamente a nosotros, y las facturas comerciales, que son documentos que nos solicitan desde aduanas para realizar todo el proceso de la devuelta de las muestras. Es importante que estas proformas, estas facturas proformas que les enviamos sean firmadas junto con la fecha del envío. Por favor, les pedimos que envíen una copia de estas proformas a gmflogistics@veritasint.com antes de que sean enviadas las muestras. Estos documentos, tanto el AW, que es la guía de envío, como la información de la factura comercial, deben ser puestas en la parte de afuera del paquete, en el mismo sobre de retorno. Se deben colocar estos documentos en la parte de afuera de la bolsa y ya se pueden comunicar respectivamente, bueno, FedEx o el courier que se utilice para que ellos recojan el paquete y lo puedan devolver a nosotros en nuestras oficinas para posteriormente lleguen al laboratorio. Este proceso es diferente para Chile. Sin embargo, en Chile, por temas aduanales, tenemos un partner que los puede ayudar con este tema, enviándoles todos los documentos, tanto los kits como los documentos. Sin embargo, ellos se comunican con ustedes para poder hacer todo el proceso, el cual es muy parecido. Sin embargo, toda la gestión la realizamos por medio de ellos. Ups, me pasé. Igualmente, para el caso que les estaba mencionando específicamente, también tanto para las personas dentro de Chile como fuera del mismo, enviamos unas instrucciones con todas las especificaciones del envío, todas las instrucciones del envío para que ustedes puedan tener mucho más claro el proceso. Y dentro de estos documentos también encuentran puntos de contacto, tanto de nuestro partner para el caso específico de Chile, como nuestros contactos para el resto de los países en Latinoamérica. Si tienen alguna duda, siempre nos pueden contactar vía correo electrónico y vamos a proveerles con todos los documentos necesarios e instrucciones que ustedes necesiten. Para el estatus de las muestras, una vez nosotros recibimos las muestras y las enviamos en nuestro hub logístico, ellas se envían directamente al laboratorio localizado en Europa, el cual está localizado en Barcelona, como les había mencionado anteriormente. En este momento la plataforma, a pesar de que no permite ver exactamente el estatus de la muestra, si nos pueden escribir al correo, a los correos que están listados aquí, operaciones.latam@veritasint.com y gmflogistics@veritasint.com, y nosotros les proveeremos con el estatus de las muestras. Igualmente, como les ha mencionado Sofía, cuando utilicen sus propios kits o tubos, si es que los tienen disponibles, por favor, solo es que nos contacten y nos pidan, pues nos indiquen que ya tienen sus propios tubos y nosotros nos encargaremos de enviarles sample IDs, las guías de retorno de las muestras, las proformas de las facturas comerciales y los sobres para la devolución de las mismas. Una vez el reporte está listo, ustedes van a recibir una notificación vía email donde se les notificará que está disponible el resultado y van a poder acceder al mismo mediante la plataforma y allí lo podrán observar.
Well, thank you, Isabella and Sophia. That finalizes the presentation. All right, so I think we want to see if we have any questions. I'm not sure if we.
There've been some questions in the chat, which I think we've addressed all of them so far.
Okay.
But if anybody else has any questions, feel free to put them in the chat. Or I believe, can people unmute themselves and ask questions? If you can also do that.
I see.
Good. I have two questions. The first one is the problem. It can be solvable, but the idea is that we have to collect 12 patients to send them. That's what we were told before. So we should try to get 12 samples to send as a pool to Veritas directly. It didn't used to be that way with the other company. The problem we run most of the time is that we don't have the possibility to bring all the patients together to take the samples the same day. So we are a lab, and we also have a research lab here, and we do DNA extraction and many other things, and we do quality assurance for the DNA and everything. And we usually, for our exome analysis with the companies, and when we do the research, we send them all the quality testing that we do for the DNA. Is it possible to send DNA from blood or from saliva instead of sending the samples?
So I'll just start by saying you don't have to send 12 at once. We would prefer if you send in batches of 5 or more just for logistical purposes. However, if that is not possible, if not enough patients can come in, in a reasonable amount of time, or if it's medically, time sensitive for the patient, you can send in smaller batches. So I just want to say that. And then I'm going to have to let Veritas answer the second part of that question.
Yeah, so the DNA question you just asked, the thing is our laboratory prefers to work directly with saliva or blood so that they are doing the DNA extraction, and they really confirm that it fulfills their quality requirements. So in case you can ship directly blood or saliva, since you don't have to send 12 samples in one only shipment, it will be preferable. In case you really need to send the DNA extracted directly, you can just contact us via jmf@veritasin.com, and we will send you the quality requirements of our laboratory. So in that case, if you can do the DNA extraction with that requirements, then we will be okay receiving that and doing the test with that sample.
Okay, good. Thank you. Thank you. And no, that was actually the two questions that I had. One of the shipment and the second of the type of samples. Thank you.
Now, I was going to say that when we launched the program, it's been a learning process, and it was perceived that we only wanted 12 or more samples, but I think that was a misinterpretation. We miscommunicated whatever happened. But as I said, it's not the case. So we are flexible with the amounts. We prefer 5 or more, but and we want to get the sample to the lab and run the analysis, because that's the whole purpose of this entire foundation. So we want to support that. And as Sophia said, we are flexible with the types of samples, and we prefer saliva, blood, and we do the DNA extraction. But there's always a way. So please contact us.
Good. And now that we are here, I have another question. I mean, we do research. Many people that are involved in this are doing research, and for publishing purposes, we have our patients here. So I was wondering also if the company will allow us, for example, to have access not only to the report, but maybe if we needed to get the chromatogram or other information that might be useful, so we don't have to repeat the testing again. Will that be possible, or you just provide the report and that's it? I understand that you also keep doing reiterative analysis to the genome, if you don't have the information right away. But in case someone wants to publish that case, is important. We do a lot of work on ourselves to help these patients, and one of the rewards, if you could say, for us is to be able to publish this so we can keep going with our work too.
I think that sure it would be possible. We can let's take that question away and we'll get back to you. But I'm pretty sure, yeah, because in the end it's your patients, and we should be able to do that. So we'll I don't know. So Martha's on the call, right? Can we take that as to take away and respond, and after we check everything?
Yeah. Sorry, Matt.
I mean, I just want to say that this question, I know, Sophia, you have the question right down. I mean, basically, if they can they use the data? Can they use to publish results and everything? I want to make sure we understand that correctly, and I would assume so. I'm just not the expert on the test request form and the interest case, but I would be very surprised if we can't do that. But I want to have a good, clear answer for you so we can confirm. Okay.
Yeah, we've noted that in the question, and we will answer as soon as we share it with the team.
Thank you.
I see that I just saw, I'm trying to find the chat. I saw a question from, I'm trying to find the chat.
Yes, so somebody asked how much time should we wait for test results? They sent 3 samples and they about 3 months ago and have yet to get their results.
All right, well, let's, usually it's between 6 and 8 weeks. We're around the 8 weeks right now because of the program ramp up and everything. It basically the volume went up very, very significantly in the August and September period, and the team now is expanded and working a lot quicker. But let us, I think, Vera Dantas, I think we need to get your sample IDs, and then we'll verify where they are and how and exactly what's the, why they haven't come out yet.
So I'm going to put in the chat the email address that she could reach out to with that information. Oh, yeah.
Thanks, Sophie. So, take it too as well, can't you, Vera Dant, Dr. Dantas, and we'll see. Okay, but yeah, the plan, and it will be 6 to 8 weeks is the official turnaround time. Right now, we're a little over 8 weeks. It should be coming down at the end of this month, going into mid-December. So that's and we are. Sorry, it's been a little bit more than what we anticipated.
Does anybody else have any questions while we're here? Feel free to put it in the chat or go ahead and ask. Unmute yourself.
And everyone can ask in Spanish as well.
Yes, I see. I know I'm trying to keep up with the Spanish here. And of course, if you think of a question after the fact, or you want to ask privately, go ahead and reach out to that jmf@veritasint.com email address at any time, and we can address your questions there as well.
Jessica, I think we have a question from Magda Carneiro.
Yes, please, go ahead.
So I would like to thank you so much for the opportunity and for clarifying our doubts. Thank you so much. I took every picture and I will send to all the COBAY members in Brazil. Thank you.
Amazing. Thank you so much.
Oh, I love to see you.
We'll be
Thank
sending
you.
out the video, the recording of this as well. So
Yes, yes, and today I am the opportunity to be in my city, the city where I was born, in Recife, in the northeast area of the country. I'm not in São Paulo. I am in Recife. Thank you so much. I'm very, very happy.
Of course, thank you. Yes, and when you get this, the recording of the webinar, you can feel free to share that with all of the members as well. If, hopefully it'll be helpful. Oh, we have one more
Vanessa?
question. Oh, sorry, go ahead.
I saw that Vanessa, I'm not sure, had her mute taken
I have
off.
no
Did you want to ask a
questions.
question?
No, I just saw Magda and I wanted to say hello
Okay, great.
because I love her so much and I miss her.
We do have a question here. Does Veritas offer family testing for free for selected variants?
No, not necessarily, but I mean, we could send us the question through the email. We'll see what the case is. That's not something that, I know that was something that before that's been done by some companies, but no, it's not something we're able to do, but we can evaluate the situation, of course, or the request.
Sí, veo en el chat otra pregunta acerca de la estabilidad de la muestra. Entonces, en caso de que sea de sangre, tiene una estabilidad de alrededor un mes, siempre y cuando sea preservada en nevera, si es posible a 4 grados. Y si es saliva, se mantiene a temperatura ambiente y también máximo alrededor de un mes. Entonces, si en ese tiempo pueden hacérnosla llegar al laboratorio, sería fantástico. Si no fuese así, ya pasaríamos entonces a la parte de ADN extraído que comentábamos antes.
Good. I'll let you say goodbye then. Wrap this up.
Well, yes, if there's no further questions or comments, then I guess we will wrap it up. I just want to say thank you again to everybody for joining us today. We really appreciate it. We hope that we answered your questions and provided some helpful information for you. We hope that if you're not already participating in the program, that you will begin. And of course, if you run into any challenges or have any questions, email me, reach out to the Veritas team, and we will do everything we can to help you. So thank you so much.